Hi, my name is Toby Everett. I'm an anesthesiologist at Sick Kids, and I'm delighted to be joined by Jen Arnold. Jen, hi, how are you doing?
I'm doing great. Nice to talk with you today.
Nice to talk with you. So Jen, perhaps I could start by asking you, what does simulation mean to you?
But what it means to me is it's really all about the opportunity for healthcare providers and sometimes non-healthcare providers to be able to practice, perfect, and improve their care and hopefully ultimately improve safety for our patients.
When people outside of our field ask you, hey Jen, what are the benefits of simulation? How do you respond to them?
Great question. I mean, what I tell people who aren't familiar with simulation or don't understand why we do it, I tell them it's all about the opportunity to practice, to rehearse, and perfect care. I share this similarity to other high-risk industries such as aviation and how, you wouldn't want to get into a plane and know that your pilot hasn't practiced or rehearsed or been in a simulator recently, right? Or at least that's how I think. Those high-risk industries like healthcare really do benefit from frequent training in a realistic environment and the ability to learn from your mistakes. And so when other people don't understand why we do it, and once I tell them what it really is, they say, well, they sort of think, well, shouldn't you have been doing that for the last, thousands of years? And I tell them, well, it's not as new as it used to be when I first got involved, but it is still relatively new in our industry. And so the benefits, though, I think are starting to be understood better. And I think now folks that aren't in healthcare are going to expect that healthcare is doing simulation.
Jen, one of the things that we're often after as simulation educators is a demonstrable impact on patient care or patient outcomes. Do you have any examples of positive patient outcomes from your sim program?
Sure. No, I think that's the golden nugget we're all looking for as simulationists. And for me, the most impactful feedback I've gotten is from our parents of kids going home with tracheostomies and ventilatory support. We've developed a training program for them to practice how to handle a high-risk emergency related to their tracheostomy after discharge. And we've actually had more than one, but one family sticks out to me the most, actually come back, give us the feedback that after they went home, they had an emergency. This one family actually had to perform CPR on their child. The tracheostomy tube became dislodged, and the mom said her Sims teaching came into play, and she did CPR. And by the time EMS got there, the baby had become responsive and actually went to the ER, but was discharged home. So to me, that was a great example of how simulation training can really impact the outcomes and save lives.